Hello everyone, good day! Today, I'm gonna explain further the anatomy of the head and neck. But first, let me introduce myself. I am Danica Dofredo, a student teacher from University of Baguio. The first topic is our skull. Skull is a skeletal framework of the head of vertebrates. It is composed of bones or cartilage, which form a unit that protects the brain and some sense organs. The upper jaw, but not the lower, is a part of skull. The human cranium is the part that contains the brain. It is globular and relatively large in comparison with the face. In most other animals, the facial portion of the skull, including the upper teeth and nose, is larger than the cranium. In humans, the base of the cranium is the occipital bone, which has the central opening to admit to the spinal cord. The parietal and temporal bones form the sides and uppermost portion of the dome of the cranium, and the frontal bone forms the forehead. The cranial floor consists of the sphenoid and ethmoid bones. The facial area includes the zygomatic or malar, which joins the temporal and maxillary bones to form the zygomatic arc below the eye socket, the palatine bone, and the maxillary or upper jaw bones. The nasal cavity is formed by the vomer and the nasal, lacrimal, and turbinate bones. Moving on to the next topic, which is the cranial cavity and the meninges. The cranial cavity is the anterior portion of the dorsal cavity consisting of the space inside the skull. This cavity contains the brain, the meninges of the brain, and the cerebrospinal fluid. The cranial cavity is also known as intracranial space. It is the space within the skull. The space inside the skull is formed by 8 cranial bones known as the neurocranium. The neurocranium is the upper back part that forms the protective case around the brain. The skull cap of the neurocranium covers the cranial cavity, and the remainder of the skull is called the facial skeleton. The skull is also known as the cranium and contains the brain. The next is the meninges. The meninges are the protective membranes that surrounds the brain to minimize damage of the brain when there is a head trauma. Meningitis is the inflammation of meninges caused by the bacterial or viral infections. The meninges are the cerebrospinal membranes invest the brain and the spinal cord, the optic nerve, and also the first portion of the cranial and spinal nerve roots. Next is the brain and its blood supply. The entire blood supply of the brain depends on two sets of branches from the dorsal aorta. The brain receives blood from two sources: the internal carotid arteries, which arise at the point in the neck where the common carotid arteries bifurcate, and the vertebral arteries. The internal carotid arteries branch to form two major cerebral arteries, the anterior and the middle cerebral arteries. The right and left vertebral arteries come together at the level of the pons on the ventral surface of the brainstem to form the middle line basilar artery. The basilar artery joins the blood supply from the internal carotids in an anterior ring at the base of the brain called the circle of Willis. The posterior cerebral arteries arise at this confluence as due to small bridging arteries, the anterior and posterior communicating arteries, conjoining the two major sources of cerebral vascular supply via the circle of Willis, presumably improves the chances of any region of the brain continuing to receive blood if one of the major arteries become occluded. Moving on again to the next topic, which is the cranial nerves. What is cranial nerves? The cranial nerves are the responsible one for our smell, sight, eye movement, and feeling in the face. The cranial nerves also control balance, hearing, and swallowing. There are 12 cranial nerves, which are the olfactory nerve, optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, abducens nerve, the facial nerve, and also the vestibulocochlear nerve, glossopharyngeal nerve, vagus nerve, spinal accessory nerve, and lastly, the hypoglossal nerve. Also, the vagus nerve has many branches and it is responsible for tasks including heart rate, gastrointestinal peristalsis, sweating, and muscle movement in the mouth, including speech and keeping the larynx open for breathing. Next is the anatomy of the face. The face can be divided into three main regions, which is the upper face, the middle face, and the lower face. The entire face is covered by skin superficially, while the deep anatomy contains muscles, fat pads, nerves, vessels, and bones. The face is a structure that is heavily innervated by nerves, which any disturbances in the innervation of the nerves will manifest as the defects in the face. So the last topic is all about the scalp. So what is scalp? It is composed of soft tissue layers that covers the cranium. It is an anatomic region bordered anteriorly by the human face and laterally and posteriorly by the neck. It extends from the superior knuckle lines and occipital turbulences to the supraorbital foramen. Aesthetically, it serves as an area where hair can grow and physically as a barrier that defends the body from foreign irritations. There are 5 layers to the scalp: the skin, the connective tissue layer, the Gragalia apuneuretica, loose areolar, connective tissue, and the pericranium. The scalp serves as a physical barrier to protect the cranial vault from physical trauma or potential pathogens that can cause infections. So that is all for my discussions, and I hope you learned something from the anatomy of the skull, the cranial cavity, the meninges, the brain and its blood supply, the cranial nerves, the anatomy of the face, and the scalp. And I hope you learned something today. Thank you so much for listening.